In the name of God, the most gracious, the most merciful. Welcome, viewers, to a new episode. Today we will discuss the dangers of diabetes and how researchers are working to avoid these risks. We know that diabetes often affects people as they age. It has many causes, some genetic and others related to dietary habits. We have discussed this in many episodes, as well as the available treatments. Please refer back to those episodes for highly useful information. Today, we will discuss the relationship between diabetes and the severe diseases that strike patients as their condition deteriorates over time, especially with old age. The patient becomes highly susceptible, more than others, to cardiovascular diseases, heart attacks, and strokes. Diabetic patients know this well, and it creates a terrifying obsession about the possibility of facing major health complications. We know diabetes is inherently dangerous, but for the record, fatalities from diabetes itself are far lower than those from its complications. It is rare for a person to suffer a fatal diabetic coma, particularly a hyperglycemic coma. However, hypoglycemic comas, which result from high insulin doses, are far more dangerous. Currently, with the emergence of new types of insulin, we have begun to largely avoid this problem. The research group we are discussing today is from South Korea, specifically from Seoul National University, one of the top universities globally. The research was conducted at the College of Medicine, Department of Neurology, and published in a specialized medical journal for neurology. The researchers studied the relationship between diabetes and strokes, heart attacks, and other fatal cardiovascular diseases. When patients are admitted to the hospital with blood clots, doctors manage them and take multiple measurements, including the HbA1c level. The number of patients admitted to the hospital with various types of clots was around 66,000. Out of these 66,000 patients, approximately 25,000 were suffering from diabetes. This shows us that nearly half of the patients who suffer from blood clots are diabetic, confirming the strong link between the disease and increased thrombosis. It was excellent that the hospital consistently measured the HbA1c for these patients. Most diabetic patients know what HbA1c is. The HbA1c is a test that shows your blood sugar level over the past 3 months. It differs from a daily blood sugar check fasting or post-meal, which only gives you a reading for that specific moment. The HbA1c analysis is done in a lab and measures your glycemic control over the entire preceding 3 months. There are standard ranges. For a normal person, the HbA1c should not exceed 5.7. For the pre-diabetic stage, or for patients actively and consistently taking their medication, the HbA1c can reach up to 6.5. If the HbA1c exceeds 6.5, we diagnose the patient as diabetic, or conclude that their current treatment is inadequately managed. In some uncontrolled cases, it may reach 7.5 or 8.5. In critical cases, the HbA1c can hit 11 or 12, presenting a major problem. Researchers took the data of the 25,000 diabetic patients who suffered blood clots and recorded their specific HbA1c numbers. They then monitored them for a full year after they were discharged from the hospital and had recovered from the initial clot. During this year, they regularly measured their HbA1c. Of course, the patients were following up with their respective doctors for treatment. The research group merely monitored sugar levels every 3 months to see if there was a correlation between glucose levels and because we all know a that if a second clot. diabetic patient suffers a clot, there is a very high probability they will suffer a second one. And the second clot poses a much greater risk to their health and a significantly higher chance of fatality than the first. The researchers monitored HbA1c levels over the year to study the correlation between these levels and the incidence of recurrent clots. The results showed that during this year, around 1,450 patients suffered a second clot, heart attack, or cardiovascular disease. Another 1,000 patients suffered a second stroke. This means the total number of patients who suffered from recurrent complications and clots was about 2,500 out of the 25,000. What did the study find? It found that patients whose HbA1c was higher than 7, meaning 7.5, 8, and above,
وفي حوالي 1000 واحد تاني جات لهم سكتة دماغية جلطة في المخ. يعني المجموع
who are the patients non-compliant with their medication or being treated improperly,
في حوالي 2500 جات لهم جلطات.
had a 30% to 40% higher incidence of recurrent clots compared to others.
الدراسة بقى لقت ايه يا جماعة؟ لقت ان الجماعة
compared to patients whose HbA1c was below 6.5 and who committed to controlling their blood sugar levels.
الناس اللي هم مش مظبطين سكرهم.
Patients who maintained a controlled HbA1c 6.4 or lower had a significantly lower incidence of a second clot. My recommendations for diabetic patients: unfortunately, most of our patients in the Arab world do not exercise or follow a diet.
أقل من 6.5 و6.4 و6 و5 و7 5.
Some reject the idea of committing to a lifelong diet or completely abstaining from carbohydrates and sugars.
مفيش نسبة حدوث الجلطة التانية دي عندهم كانت أقل كتير جدا جدا والدنيا عندهم مظبوطة بحد كبير جدا. توصيات بقى مريض السكر يعمل إيه؟ عشان يحافظ على التراكمي بتاعه بين 5 و7 و6.5.
Fortunately, modern medications now control diabetes much better than the outdated regimens that used to be prevalent.
ما بتعملش رياضة. ناس السن الكبير بيبقى الرياضة عنده شبه معدومة أو هو صحته ما بيقدرش على الرياضة، ما عندهمش نظام غذائي ويقول لك وانا هفضل طول عمري ماشي على النظام الغذائي، يعني انا مش هاكل نشويات خالص مدى الحياة، مش هاكل سكريات، مش هعمل ده كله. فهو المريض بتاع السكر عاوز يبقى عنده نسبة من الحرية انه يعيش حتى زي الناس.
Doctors have begun to realize the importance of these modern drugs, prescribing a cocktail or combination of medications that work together to control sugar. Doctors are also moving away from older diabetes drugs that exhaust and squeeze the pancreas, which used to accelerate the patient's transition to insulin dependence. I always warn against these older medications, as there are much better alternatives available now. This old family is called Sulfonylureas. This includes drugs like Emeril, Dayanil, and Diamicron. I do not recommend using any of these old commercial names.
أدوية طبعا أنا دايما بحرص إن أقول للناس ما تاخدوهاش، لها بدائل أفضل منها حاليا. هي عيلة اسمها السلفونيلوري.
If your doctor prescribes them, consult with them about switching. But if they insist for a specific medical reason related to your case, that is their clinical judgment. However, the biggest mistake is continuing on these medications for years on your own, simply because a doctor prescribed them 5 years ago. I advise you to stop that and consult your doctor, as these drugs can damage pancreatic function over time. Medicine evolves, and safer, newer drugs are released. The modern approach to treating diabetes is not to prescribe just one single medication. There is no such thing as take this one drug and stick with it.
فلازم تتابع مع الدكتور، والدكاتره بيجي لهم نشرات بالادويه الحديثه اللي جدت، وبيغيروا للمريض على حسب استجابته وحسب مستوى السكر بتاعه. فحاليا الترند في
You will
علاج
find a
السكر
modern
هو
prescription
عدم
contains a
اعطاء دواء
combination
واحد
of
للمريض.
2 or 3
مفيش حاجه يا
drugs,
جماعه
plus
اسمها
vitamins,
خد
to manage
دواء
sugar
واحد للسكر
comprehensively.
وامشي عليه.
Some of these
الروشته فيها
medications
دواء
reduce
واحد
blood
وشويه
sugar
الفيتامينات بتاعه
production by
السكر.
sending
بيبقى
signals
في
to the liver
كوكتيل
to
من
decrease
دوايين او
glucose
ثلاثه
secretion.
بياخدهم المريض علشان تظبط له
Other
السكر.
drugs increase the
في
body's
حاجات من
insulin
الادويه دي
sensitivity, helping cells recognize,
بتمنع
absorb,
او
and
بتقلل
utilize
انتاج
sugar
السكر
efficiently.
في الدم. بتقول للكبد، لان
One
الكبد
of the
فيه
most
كميه
important
سكر
of these
كبيره،
medications
بتقول
is
للكبد اهدى
metformin,
شويه
commercially
وبطل
known as
انتاج سكر.
glucophage.
وبتزود حساسيه الجسم للسكر، بتساعد الخلايا على التعرف على السكر
Currently,
وامتصاصه،
there are even stronger
وبتزود
alternative medications on the way
التكسير
to avoid
والاستفاده من
glucophage's side
السكر.
effects,
اهم
like
الادويه
colon
دي زي حاجه
disturbances
اسمها
or reduced
الجلوكوفاج او
vitamin B12
الميتفورمين.
absorption. We will
وحاليا
discuss
هينزل
these
دواء
stronger
جديد جدا
alternatives in a
ناس
future
كتير قوي
episode,
بيتعبها
God
الجلوكوفاج،
willing.
يا اما بيعمل لها
There is
مهلكه
also a modern family of
القولون،
drugs that
او بيعمل
excretes
لها
excess
مشاكل
sugar
بيقلل
through
امتصاص
urine.
فيتامين بي 12. نازل حاجات جديده من الجلوكوفاج ده تتلافى الموضوع ده واقوى منه كمان. هنتكلم عنها في
This
حلقه
prevents
قادمه ان
sugar
شاء
from
الله. في
accumulating
دواء
in the
كمان
blood,
لما
flushing
السكر
it out
عندك
before it
بيعلى في
spikes
الدم
and harms the body.
بيعمل له
I
عمليه افراز في
dedicated a
البول.
previous episode to this
لما يبقى
specific drug
بيعمل
This
افراز في
medication
الجسم
is incredibly
لازم
beneficial for heart protection,
الدواء ده
which is
اللي هو
essential for
بيخرج
preventing the
السكر في
blood
البول ده
clots we are
قبل ما
discussing
يعلى في
today.
الجسم ويضر الانسان. ده الادويه هي عيله من الادويه يعني اتكلمت عنها في حلقه قبل كده وارجعوا لها. وهنتكلم عن انواع
Therefore,
جديده
any
نازله منها
diabetic
كمان.
patient over
الدواء ده كمان
45 or
بيحمي
50
القلب،
must have
مفيد جدا
medications in
للناس
their
اللي عندهم
regimen that
مشاكل في
protect
القلب.
their
زي ما
heart,
بنتكلم
blood
موضوع
vessels,
بنتكلم عنه
and
النهارده.
kidneys, while
فده يوجد
keeping their
مريض من مرضى
HbA1c
السكر
normal.
وكبر في السن، عدى 45 عدى
My
50 سنه،
final piece
لازم
of
نديله دواء
advice, and this
عشان
is a
نحمي
broad
قلبه
topic that needs
ونحمي
more
الاوعيه
time,
الدمويه بتاعته
concerns
وكمان نحمي
patients
الكليه
who have
بتاعته
reached the stage of
وننزل
using
مستوى
whether
السكر
it is
بتاعه
type 1 or
دايما يبقى
type
في
2
رينج
diabetes.
طبيعي.
You should never rely
كمان
solely on
نصيحتي
insulin as your
ان
primary treatment
الموضوع ده
along
طبعا
with just
كبير وعاوز وقت
vitamins.
كبير له، بس بنتكلم
A patient
يعني
cannot be
ايه
managed
اجمالي
on insulin
لمرضى
alone,
اللي
whether
بياخدوا انسولين
long-acting, rapid, or
واصل
mixed.
خلاص لان
High
هو
insulin alone
سكر
causes
منوع لانه
multiple
بياخد انسولين.
problems.
مرضى اللي بياخدوا انسولين يا جماعه مفيش حاجه اسمها انك انت تاخد انسولين بس، يعني تقول ايه انا الدكتور
Therefore,
كاتب لي على
insulin
انسولين
must be
للسكر
combined with
مع
modern
الفيتامينات
oral
مع فيتامينات
medications.
السكر ولا
Why?
الكلام ده كل
First,
ده
to
لانه
significantly lower the insulin
لازم
instead of relying
دايما
entirely on massive
المريض
doses
يمشي
40,
على
50,
انسولين، اي
or
نوع من
60
الانسولين،
units.
انسولين
Oral
طويل
medications
المدى،
reduce the body's
انسولين
need for external
سريع،
insulin. Second,
ميكس تارجت
modern oral drugs
فيتامين،
mitigate the
قلم
side effects of
الانسولين
insulin.
بانواعها. يا
By
جماعه
adding a
الانسولين
regulator like glucophage or
الانسولين
drugs
ده
that excrete sugar in urine.
مشكله وليس حل.
The insulin
فانت
dose might drop from
كمريض
40
سكر
units
لما
to
تلاقي
just
علاجك
10
انسولين
units of
بس
basal
مع
long-acting
الفيتامينات او
insulin.
كده، لا ما عادش
This
هذا
way,
المبدأ
I
موجود.
protect the patient
مريض
from the
السكر
dangers of
اللي
high
بياخد
insulin
انسولين
doses, most
لازم
notably
ياخد
severe
معاه
obesity
ادويه
and
تانية
accelerated
اولا
cellular
بتخفض
aging
جرعه
while
الانسولين،
simultaneously controlling their sugar.
تخليه بدل ما يعتمد
High
على
doses
الانسولين
of
فقط
insulin
يعمل له
accelerate
60
human
وحده و40
aging.
وحده
The lower the dose you use,
و30
the
وحده
better it is
والكلام
for
ده
your
هيخلي
overall health.
كميه الانسولين يحتاجها الجسم من بره قليله. تاني حاجة إنها بتتلافى جميع الأعراض الجانبية والمشاكل اللي ممكن يسببها الأنسولين. فبدل مثلا ما المريض بياخد 40 وحدة أنسولين 50 وحدة أنسولين بنديه الأدوية بتاعت السكر، بنديه ممكن نديه جلوكوفاج، بنديله الأدوية اللي قلنا بتنزل السكر من البول وبتحمي القلب والكلام ده. فممكن بدل ما بياخد 40 وحدة ممكن ياخد 10 وحدات بس من الأنسولين وانسولين طويل المدى. فكده يبقى انا
This is a vast topic, and we will discuss it in more detail in future episodes with new research. That is all we have for today. Thank you, and peace, mercy, and blessings of God be upon you.
وكل ما كتر الانسولين، لان الانسولين يا جماعه يعني واعذروني ان في الحلقه دي ان انا بستفيض، الانسولين يا جماعه من المواد اللي بتسبب تسريع الشيخوخه، يعني بيسرع شيخوخه الانسان. فكل ما قللت جرعه الانسولين كل ما كان افضل. فموضوع كبير وهنتكلم عليه ان شاء الله في حلقات جايه ومع ابحاث تانية. وده اللي عندنا النهارده، وشكرا والسلام عليكم ورحمه الله وبركاته.